via Scion. Today we're going to be reviewing the Zoll Resuscitation System model number 100. Now remember, you only want to use this as an adjunct to manual CPR, and you can only use it in patients who are under 300 pounds, over the age of 18, and only in non-traumatic arrests. But first, let's review the buttons. Over here we have our on and off switch, which is located on the side, and our user control panel. The green start button is used to analyze patient size with the LifeBand or starting chest compressions. The orange stop or cancel button is used to stop or cancel analyzing the patient's size or to stop chest compressions. The menu or mode switch button is used to enter the communication mode, view the last patient session information, view platform information, or view battery information. The up and down button allows you to highlight for different selections in the menu. The select choice button allows you to select the currently highlighted menu item. The tone mute button allows you to mute tones for a short period of time as set in the administration menu. The increase and decrease contrast button allows you to change the contrast of the screen. The green LED light lights whenever the AutoPulse is powered on and able to respond to user input. The red LED light alerts whenever there is a user advisory, a fault, or system error. So the first thing we want to do is remove the patient's clothing. The easiest way to do this is lift up the patient, have someone cut a straight line down through their clothing, and then rest the patient down on the AutoPulse backboard. When you place the patient back down on the board, you want to make sure that this yellow line is right underneath the armpit. Next, we'll place the life bands, the first life band, and then the second life band. The second one will fit right into the first life band, right on top. They're velcroed together. You're going to lift straight up so that they're perpendicular to the board and you don't see any twisting in either side on the patient. When you place it straight down, this yellow line should match up to the yellow line right on the board. We're then going to go ahead and hit continue. The life band is going to size the patient and then begin compressions in a couple of seconds. So we'll go ahead and hit the green button. Now during CPR, you want to make sure that this yellow line always stays in line with the yellow line on the board. If it doesn't stay in line, I'm going to hit the stop button and realign the life band. To realign the life band, you're just going to lift straight up, perpendicular, make sure there's no twists, and place it straight back down. I'm going to hit the continue button. It'll tighten up again. Once again, check that alignment. Right now we're on a 30:2 compressions to ventilations ratio. I want to change that, so I'm going to come over to the gray button and switch to continuous. Now we have a continuous compressions mode. Now let's say we need to stop compressions again. Come over to hit the stop button. We want to make sure that we always stop when we realign the life band and when we defibrillate a patient. Then we can go ahead and hit the continue button. Now you notice that it's beeping as I'm talking, as there's no compressions going on. It's going to continue to give you tones until you hit the continue button. to remind you that there are no compressions going on at this time and that you should continue and hit the green button. It's going to realign again and then start compressions. Now I noticed that our battery is good. We have all 4 battery cells, so we don't have to worry about replacing the battery. Now let's go ahead and say we need to do a pulse check. So I'll hit the stop button, and we notice that our patient has a pulse, so we do not want to continue compressions. You can come over to the stop button again and notice that it says quit. We're going to hit that stop button. To turn off the AutoPulse, we'll come over to the on-off button and push it in. After use, we always want to change out our light band pads. These are not reusable. So we're going to flip the AutoPulse over. We're going to open the clips on the side and then the 4 clips on the inside. Straighten out our band here. You want to make sure that it's lined up. You're going to push in the white piece and pull out our clip. Now for our replacement band, you want to match up our 2 graphics here. Take our clip, push it in on the one side, and clip it in. You want to make sure our band is straight here, and our clips are out, and you just snap it into place. And then snap the outside. And so that is the AutoPulse.